Okay. So one of the questions is, gee, Dr. Rutledge, you recommend orange juice and tomato juice. Isn't that kind of acidy? Isn't that kind of going to burn the stomach? And so I want to talk a little bit about that. Most or many people can drink orange juice and it doesn't bother their stomach. But some people drink orange juice and they get a burning or irritation from it. Why is there a difference? Why do some people drink orange juice a lot and it doesn't bother them a bit? And why do some people drink orange juice and they feel burning? And then I want to go on from that and I want to ask you, if you have that kind of situation where you drink orange juice or tomato juice and you feel kind of that acid burning indigestion, what should you do about it? Well, one thing you can do is, well, don't drink orange juice. And I want to come back to finally concluding that that is absolutely the wrong answer. So let me see if I can explain it. Orange juice is pretty acid, but it's small potatoes compared to the acid that's in your stomach. Your stomach acid looks at orange juice and laughs. You call that acid. I got acid. Inside, you have hydrochloric acid that if you dropped a chicken leg in there, it would dissolve it. In fact, it does. Right? We just heard. It dissolves fried chicken. Well, if it does that, how comes it doesn't dissolve itself? Well, it has a miraculous lining, a mucosal barrier that protects it from the acid. And if you pour orange juice in a stomach that has that barrier intact, you can't even tell. Now, on the other hand, suppose you scrape away that mucosal barrier and cause an ulcer. Well, then you may get pain anytime, just from the acid in the stomach. Or, when you drink orange juice, it hits that raw, cut open area, and then you get burning. But if the stomach and the esophagus are intact, with their normal mucosal covering, with the normal mucus lining, you can't feel the orange juice. And I'll give you two examples. I think we did this in clinic the other day, but let me do it again. Imagine that we all get to go to Hawaii. We went to Oprah. We were all on Oprah together. And Oprah gave us all a trip to Hawaii. And we get to the hotel, we get our shorts on, and we decide to walk down to the beach. And as we're walking down there, we're all in a crowd talking. Well, I'm mainly talking. And I trip up, and we all fall, and every single one of us scrapes open our leg and our knee. Great big open cut on the coral. Then we walk into the ocean. What happens when that salt water hits that raw, open wound? Really hurts, right? Now, replay that, and now we walk into the ocean, but without that open cut. The salty water doesn't bother you a bit, does it? When you drink orange juice, if it bothers you, red alert. The mucosal lining has been breached. It doesn't mean to stop drinking orange juice. It means call your doctor because you got a hole in your stomach. You got a scrape in the lining there. It's red and eroded and irritated for some reason. Drink orange juice every single day as a diagnostic test to see how your stomach is doing. If it bothers you, call me. It shouldn't bother you.
How about heartburn?
Heartburn is the same deal. You should not have heartburn. If you got heartburn, something's wrong. Heartburn is not right. Now, what's the most common cause of heartburn in the United States today is the acid from the stomach washes back up into the esophagus. And that's called gastroesophageal reflux disease. And you know about it because it's advertised every night on TV for the purple pill and Nexium and all these drugs. Okay? But again, if you get that heartburn, red alert. Something's wrong. Acid is going up here, things like that. But if you drink orange juice and you get pain, that doesn't mean, oh, I think I'll fix this by avoiding orange juice. It means you got a hole in your stomach, you need to get it fixed. In fact, it's like having an x-ray test every single day of your stomach and to see how it's doing. You drink orange juice, it bothers you, something's wrong. If you've had the MGB and you drink orange juice and it bothers you, call me right away, because remember, what is our biggest long-term risk and complication? Ulcers. If you drink, I want you to drink orange juice every day. And if it bothers you, I want a phone call, because we'll fix it. We'll give you anti-ulcer medicine. That's that simple. Some people try and get around it, and then they get sick, and then they have a bleeding ulcer, and then they have problems because they're drinking the caramel macchiato for breakfast.